All right, my first study is a quasi-experimental study. It's a prospective controlled trial study with blinded outcome evaluation. So it would have been a randomized controlled trial study, except that the 124 participants that were enrolled in this study in a teaching hospital in Australia, they were elderly adults that were admitted inpatient to the hospital, and an intervention was implemented, but they did it by two different units in the hospital. So those that were admitted to one unit received standardized care, and those that were admitted to a second unit received this multidisciplinary intervention that was what the study was about. So they weren't able to truly randomize it by selecting which patient went where. They just followed the patients that were admitted to each of those two units. So it was a quasi-experimental. But with these 124 adults, they found that the multidisciplinary intervention was really effective. So what they did was they trained the staff on that unit in awareness on delirium prevention. They did early ambulation. They utilized physical therapy and occupational therapy. They did screenings that they had educated the staff on. And I think they did try to get the families more involved as well. And they had a couple other things in a whole multidisciplinary approach as far as an intervention to prevent the delirium, and found that it was really effective for those patients. They used a screening called the Modified Barthel Index at admission and discharge. They also looked at length of stay. They looked at the incidence of delirium. They looked at falls. They looked at measured activity and readmission rates to see how this intervention applied to all of those things. I'm looking specifically more at acute delirium, but it showed all of those things. So it was a really strong study and good findings that this intervention proved helpful in preventing acute delirium.